what do I do if I start having bleeding on my hormone replacement therapy? Well, the first thing I recommend is that you call your practitioner and tell them what's happening. Although it is very common for bleeding to occur on hormone replacement therapy, depending on your age and your medical risk factors, we may decide to do a little bit more investigation to be sure that it isn't anything else outside of your medication. There are structural reasons for bleeding that can occur. So polyps, fibroids, abnormal tissue inside the uterus that could be precancerous. And those other risk factors should be considered and evaluated depending on your age, how long this has been happening, when did it start in relation to your hormone replacement therapy, and have you had a family history? So we look at all of these pieces as we're deciding whether or not further testing, such as an ultrasound or a uterine biopsy of the lining, is necessary. So in general, if you start experiencing any irregular, abnormal patterns of bleeding, or even bleeding in menopause, I always recommend that you reach out to your practitioner and then clinically decide together what, if any, additional testing might need to be done.